Hello. We're going to pick up in week 5 of Allied Health with chart 3. So you guys did a really great job this week with your chart 2. So, ta-da, you get another one. Oh, there's 11 of them, so hopefully we can get through them all this semester so you don't have to worry about them second semester and we can do the really cool stuff. So, looking back at your chart 3, okay, so this first abbreviation is carbohydrate. Carbohydrate is a chemical structure that we find in foods. It gets broken down into sugar by our body. So if you look at a nutrition label, it'll say X grams of carbs, carbohydrates. That's what they are. It breaks down into sugar. So it's abbreviated as CHO. This is a chemical abbreviation that we use in medicine for carbohydrate. Then we have cholesterol. Just so you know, only 8% of your cholesterol level is dictated by your diet. The other 92% is produced by your body. So if you naturally are prone to having high cholesterol in your blood, which are fatty acids that perform functions on the surfaces of your cells, then you may need to control your cholesterol with diet and exercise. Mainly exercise is the best way to control it. And if those absolutely do not work, then they will prescribe what's called a statin drug. But you don't want to do those because they cause more problems than they fix usually. But cholesterol, it's CHOL, all lowercase. CICU, this is cardiac intensive care unit, so CICU, all uppercase. This is a department inside of a hospital that specializes in cardiac patients that need intensive heart monitoring. CK, this means to check, like you check on your patient. Yes, like you check a glucose. There you go. All right, so Cl, it's a capital C and then a lowercase l. So this stands for chlorine, also known as chloride in the chemistry circle of things. So if we look at the periodic table of elements, so this is part of chemistry. So if you've never had chemistry, these are all of the elements that make up everything we see, feel, use, okay? And chlorine is over here, all right? So we use chlorine to disinfect water. We use it to disinfect pools. It just naturally kills just about everything it comes in contact with. If we bind it with sodium and make sodium chloride, then we can use that to make IV solutions. We can use that as table salt, that kind of thing. All right, going back. Cl space LIQ, this is clear liquids. You could go on a clear liquid diet, which is where your doctor will have you drink Sprite, water, basically things that don't have dyes or food coloring in them. Okay. Next is centimeter. This is a unit of measurement that we use in medicine. Everybody else is standard across the world. America just wants to be different and does everything in inches and feet. But generally in medicine, if you have a laceration on the arm, which is a cut on the arm, you will measure it in centimeters. You'll say this is a 5 or 10 centimeter laceration on the left anterior lower arm, right? So centimeter, cm. CMA, this is a certified medical assistant. Okay, so you can be a medical assistant and not be certified. They may train you on the job to do this, to be a medical assistant in that particular facility. However, in that instance, your designation would be an MA, not a CMA. A CMA has gone through the training and the schooling necessary to be a medical assistant. CNP, this is a certified nurse practitioner. So a nurse practitioner is a nurse that has gone through a diagnostic training route in graduate school to be able to treat and diagnose patients. So this requires either a master's or a doctoral level. And once you become a nurse practitioner, if you've gone through all that schooling, you're considered a certified nurse practitioner, so CNP. CNS, this is the central nervous system. And I pulled up a picture here. All right, so how about I go to the right one? Here we go. So this is a picture of the nervous system as it branches throughout the body. And you have two different locations of your nervous system. You have the central nervous system, and you have the peripheral nervous system. The central nervous system consists of your brain and your spinal cord. And then when it branches out from there, everything else is considered the peripheral nervous system, but your central nervous system, or CNS, is your brain and your spinal cord. Very important. Okay. CO or C/O, all lowercase, means complains of. So quite frequently, as an EMT in my reports, I'll put unit arrived to the patient's residence to find the patient sitting on the couch. CO, chest pain or difficulty breathing, right? They're complaining of chest pain or they're complaining of difficulty breathing. And I'll put that straight into my report. CO, this has one of two meanings. So we could do carbon monoxide, okay, which is similar to carbon dioxide, except for it only has one oxygen molecule, one oxygen atom in that molecule. And carbon monoxide is in particularly dangerous to your body because your body is, your red blood cells, your hemoglobin proteins in your red blood cells are meant to carry oxygen. Okay, that's their sole purpose in life, is to carry oxygen, and they're going to do it to the best of their ability. And oxygen, air, is O2. Okay, so if there's 4 sites on this protein, right, it looks like a square, right? So if there's 4 sites, 4 corners on this protein to bind oxygen to, and they can only carry 2 molecules of oxygen because each one has 2 atoms of oxygen. If it sees carbon monoxide, it says, oh, hey, I can carry 4 molecules of oxygen. Bam! That's so much better. It's really not. It causes you to suffocate from the inside out. And a sign that it is carbon monoxide poisoning is your skin turns beet red because it has lots of oxygen in it, even though that oxygen your body can't use. So there's that. Coronary occlusion. So this coronary refers to the blood vessels that supply your heart with blood. And it's like a normal blood vessel, okay? And an occlusion is a blockage, all right? So this is a normal, healthy blood vessel. Then here's with a little occlusion, a little more occlusion, and this is almost completely occluded, okay? So a coronary occlusion is a blockage of a blood vessel that supplies your heart with blood. Okay. CO2, and this should really be CO2 like that. Okay, so this is what we exhale. All right, so when we inhale oxygen, we exhale carbon dioxide. And that's literally 1 carbon and 2 oxygen atoms all together in a molecule. And we can't use that oxygen because it's bonded to a carbon. And our bodies aren't meant to break that bond between the oxygen and the carbon. So it's kind of a loss for our body, but it's a waste product and we excrete it by exhaling. Next, we have complete or compound. We like to use this verbiage for fractures, to describe fractures. So if you have a fracture, which is a broken bone, okay, you could have a simple fracture. All right, this is kind of like a hairline fracture. It may or may not go all the way through the bone, but ultimately the bone is still able to stay intact and stay in one line. If it's a compound fracture, okay, that means that it's completely fractured, all the way through. So compound and complete kind of mean the same thing, but we use it to refer to fractures. That's an open fracture. It's sticking through the skin. Okay. CONT, this is continued. This is to continue something, so to keep going, right? Okay. So this is all I have for the first video. I have a second video. It's only a few minutes long, and it's all about chronic obstructive pulmonary disease, which is our next abbreviation. And I want to make sure that you guys understand what it is, what causes it, how do you treat it, because this is a really common thing that affects people in the world. And there's two parts to it. There's emphysema and there's chronic bronchitis. And both of those are considered forms of chronic obstructive pulmonary disease. So go ahead and view the video, answer the questions, and I will see you starting with COTA. Thank you.